executive board, the marketed team, and our sponsors. We certainly wouldn't be able to put on these amazing events without them. So we like to thank them for their support. My name is Priscilla Cabral. I work for the Commonwealth School of Medicine here at Geisinger. I am part of the BOLD Employee Resource Group, and I am a co-chair for the Education Subcommittee. A little bit about BOLD. It's a Black Outreach Leadership and Development Employee Resource Group. It's a Geisinger employee resource group that supports the Africans in the diaspora, which is all cultures and ethnicities that fall under the African descent umbrella. BOLD accomplishes its mission by sharing data and stories that include experiences relating to diversity, inclusion, equity, social justice, and belongingness, hosting events that support his and her stories that represents its diverse work group and provides a professional, personal mentoring and sponsorship within the community to secure a pipeline of talent for upcoming strategic leadership positions. We have a call to action for all our members, the BOLD members, to join a subcommittee and to attend and be involved in as many events as you can. I know from experience that it is very rewarding to be part of a subcommittee, and we're able to do a lot within Geisinger and for the community. So we do want to encourage everyone who can and who is a part of BOLD to be as actively involved as they can. We also have other Geisinger employee resource groups here at Geisinger. To name a few, we have, of course, BOLD, Women Lead, G Pride, VetNet, and GAIN. All the emails you see here are people that you could reach out to if you wanted to join one of these employee resource groups. And we certainly encourage that here at Geisinger. Today, we are going to be hosting another giveaway of the mugs that we've been giving away this month for Women's Month. We had the winners from our March 16th event. I know I was very happy to see my name in the list of winners. So I'm sure the other winners are happy as well. We will be getting in contact with everyone. It does take a while for those giveaways to come out to you, but they are on their way. I'm going to post this link in the chat so that we could do the giveaway again today. You could also scan the QR code now if you'd like, but we are going to be posting that in the chat. Let me do that now before we move on and I forget. But like I said, they're nice mugs and we'll be.
I've done it already, Priscilla.
Oh, you've done it? Okay, thank you. So yeah, so just enter your name into the spreadsheet if you'd like to win a mug. Right. This month, we were able to put together a nice presentation of Black Excellence in Medicine Untold Stories series, really highlighting some amazing Black women who have been doing and have done great things in the medical field. We've highlighted quite a few so far this month. We're going to highlight a couple more today. I'm going to go through some of the slides of the women we have highlighted just to give them another spotlight. The first woman we did was Rebecca Davis Lee. She was the first Black woman to earn a degree in medicine. We also highlighted Jane Cook Wright. She was known for the woman who changed the landscape of oncology. And we have Dr. Kazmiki Corbett. She was a scientific leader in the coronavirus vaccine and immunopathogenes team at the National Institute of Health. We also, this month, we had International Women's Day. It's a celebrated globally holiday that celebrates the accomplishment of women. And we're very happy to participate in that and create events that highlight women throughout this month. We also highlighted Mae Jemison. She was the first African-American woman to travel in space and was an MD in the Peace Corps in West Africa. Dr. Jane Reed works at Harvard. She's the Dean of Diversity and Community Partnership. We also have Deborah Dees. She is an advocate for the medical profession and is doing great work in the California, where she's based out of. And we did Deborah Pathro-Stilth. She's a Dean and Professor of Medicine for the College of Medicine at Charles R. Drew University of Medicine and Science. Now I'm going to introduce Yvette Johnson, one of our students here at the School of Medicine, and she'll be doing the highlights that we have for the feature spotlights for today. Yvette, go ahead, just let me know when you'd like me to advance the slide.
Okay, hi, thank you, Priscilla. Hi, good afternoon, everyone. My name is Yvette Johnson. I am a current graduate student here at Geisinger Commonwealth School of Medicine. I am also an aspiring physician. We can go to the next slide. Okay, so today I have the pleasure to spotlight Dr. Judith Absalon. Dr. Judith Absalon is the Senior Director in Vaccines and Clinical Research at Pfizer at a Pfizer research site in New York. She is a first-generation Haitian American with many physicians in her family. Dr. Absalon's focuses are infectious disease and public health. Being the head doctor that oversees vaccines in the clinical trial process, she was instrumental in the development and push through of a Pfizer vaccine many are receiving today. Of clinical trials, she says, you start with a question. If you're lucky, you get to figure out how you're going to answer the question. Then through diligence, persistence, and flexibility, you gather evidence. You're lucky if you get the answer you hope for, but what's most important is that you're abiding by the process. That's hypothesis generation, clinical trial development, and execution. That's what we do. Next slide, please. The next person that we want to spotlight is Dr. Nicole Alexander Scott. Dr. Nicole Alexander Scott is a board-certified physician in pediatrics, internal medicine, pediatric infectious diseases, and adult infectious diseases. She currently serves as the Director of Health for the State of Rhode Island's Department of Health. Dr. Alexander Scott's main focus in her role as director are addressing the socioeconomic and environmental determinants of health, eliminating disparities of health, and promoting health equity while ensuring access to quality health services for all Rhode Islanders, including the state's vulnerable populations. A true servant in her field, she has been recognized by numerous organizations at both local and national levels, including the Rhode Island chapter of American Academy of Pediatrics and the Kresge Foundation. I am honored to celebrate these phenomenal women and acknowledge some of their contributions to medicine. As a woman of color and a first-generation college graduate pursuing a career in medicine, it is so inspiring to see women that look like me go through this process and do remarkable things. It fills me with the determination to continue this path and make a difference in my own community. Thank you.
Thank you, that was great. We appreciate it. I am going to introduce Ms. Naomi Francois, and she is going to introduce our speaker. Dr. Opara has joined us, so go ahead, Naomi, and let me know when you'd like me to advance the slides.
Hi, I'm Naomi Francois. I'm a second-year medical student here at Geisinger Commonwealth School of Medicine, and I'm going to be introducing Dr. Ijeoma Opara. Next slide, please. So Dr. Opara received her medical degree from Wayne State University School of Medicine and is a graduate of Detroit Medical Center Internal Medicine and Pediatric Combined Residency Program, after which she served as Chief Medical Resident. Currently, she is a double board certified assistant professor of internal medicine and pediatrics at Wayne State University School of Medicine, an associate program director of the internal medicine and pediatrics residency, and an attending physician with Wayne State University Physician Group. Dr. Opara is definitely a role model for me as not only a woman, but a woman of color, specifically a Black woman. And her topic today means a lot to me because it's important that we are advocates for our patients, but it's important for patients to advocate for themselves as well, and that we help them empower themselves to be able to do so. So it is my pleasure to introduce Dr. Opara.
Good afternoon. Good afternoon. Can you hear me? You can hear me okay? Yes. Good afternoon, and thank you so much for inviting me this afternoon. Please forgive me. I'm in the office. I just finished rounding, and I just pretty much ran up here to the office. So I am so glad to be here. I'm so grateful that you have me, invited me to share this space and time with you all. It truly is an honor. So I will not speak long. I actually want this to be more interactive and more so answering questions from you all, from the audience, than anything else. But I will just give a few comments, a few remarks, and then we'll go from there, okay? So what I'm hoping to address this afternoon is to talk about the importance of self-advocacy. What is it? Why is it important? And how do we advocate for ourselves, especially as women, and particularly as Black women and women of color? And what does that look like oftentimes? Okay. So what is self-advocacy in the first place? Essentially, there are many definitions for what advocacy looks like, or what it means. And you won't find one consensus statement that addresses advocacy as a definition, but there are different types of descriptions for what it is. Ultimately, they all come down to the basics, which is essentially the ability to express what you need and to navigate a system in order to obtain that which you need. Okay, so the ability to express what it is that you need, and the ability to also navigate a system to actually obtain that thing that you need. What the literature tells us in terms of self-advocacy is that it has actually been found to be correlated with health outcomes. People who are able to advocate for themselves have actually been noted to have better health outcomes, especially when they have chronic illnesses. Unfortunately, of the people that are least likely to advocate for themselves, we have found that Black women are the folks that are least likely to advocate for themselves. There are a lot of reasons for this. I'm going to ask you, why do you think that is? Why do you think that of all the people, of all the different populations around self-advocacy, Black women are the ones found to be least likely to advocate for themselves? You can unmute or you can put it in the chat, whatever works for you. What are your thoughts? Let's see. Go ahead, put in the chat or unmute. I'm looking through the chat.
I think that maybe one of the reasons could be I know from my own experience, it's kind of intimidating when you're in a doctor's office. You don't know what you should be asking. You don't know if you can ask, how it will be received. So I think that definitely could be a reason why Black women are more likely to have these issues.
Absolutely, you're 100% correct. The intimidation factor is huge around, maybe, and kind of linked to that is self-doubt, and then how will it be received? And I think the intimidation factor, that's true across the board, regardless of, what population or what background or what demographic you belong to. That sense of, the doctor is the expert or the healthcare professional is the expert and I'm not, right? So there is that sense regardless. But for Black women specifically, the second part is certainly applicable, which is how will it be received? And oftentimes when we speak up for what we need, how are we often perceived? Go ahead and unmute or put in the chat. How are we often perceived when we speak up for what we need? What is the trope that is commonly assigned to Black women when we speak up for what we need?
I think I can speak for everyone when I say angry.
Exactly.
Difficult. Somebody posted difficult, Faith posted difficult. So
That's-
definitely the stigma out there.
That's right. That's the stigma. Angry Black woman, right? When we ask for what we need. And so the data shows us that we are often not listened to, and we're often not heard and feel invisible. And I'm seeing here, people said bad past experience with healthcare professionals. Heather says, yes, absolutely. And Priscilla, thanks for putting the definition in the chat. Thanks for that. Access issues, Heather says, yes. And access, I would say, not just access to healthcare per se, but access to quality, respectful, culturally sensitive or culturally relevant healthcare. So it's not just the healthcare itself, but the type, right, of care, that access. Yes, so all these are great ideas, folks, and thanks for responding. Continue to put in the chat your thoughts. But you're absolutely correct. So we've had negative past experiences where we're either labeled, we're not heard, we're not given, we don't receive that which we're asking for. We have that stigma attached to us. And so when that happens over and over and over again, guess what? What's the natural response? To just kind of shut down. Ironically, Black women are women of color, but particularly Black women are the strongest and most powerful advocate for other people. But when it comes to ourselves, not so much. And then you have the caretaker syndrome, which I think Yvette is saying Black women tend to put everyone else before themselves, tend to take care of themselves last. You said it, you are preaching, Yvette. Absolutely, we do. And the literature bears that out as well. Like I said, when it comes to being the strongest advocate for other people, Black women are certainly the leaders. But when it comes to being advocate for our needs, not so much. And Dr. Sapp says, access to respectful, cultural sensitive, and cultural relevant care, absolutely. That we as a community certainly struggle with that, because sometimes when we use the word access, it's almost, I think the implication is, well, is there healthcare present? Is it accessible? Like, is it physically, can I go to this healthcare center and get some care, this hospital, this clinic? But yeah, that's one level of access. But another level of access is not as tangible. It is, should you show up to that clinic? Are you going to be respected? Are you going to be, receive the care that is dignified, that lifts up, lifts up your humanity, right? So there is that level of access as well. So excellent. So now that we've talked about what is, sorry, my office, I have like this movement sensor light, so I have to kind of move. There we go. for the light to come on. So now that we've talked about what is advocacy and self-advocacy, and then why it is important, and we've talked about, and why is it important? Because like I said, what the literature shows is that there is a correlation between people who are able to advocate for themselves and their health outcomes. So people who are able to advocate for themselves enjoy better health outcomes. They have better health. And so it's so important, therefore, that we know how to do that. And so that leads us to, we talked about the what, the why, and then how. How do we go about advocating for yourself? So let me tell you that involves my own history, and then we'll talk about I'll tell you two stories, my story and then the story of someone that you may have heard about. And then we'll kind of break it down into a few kind of steps in terms of self-advocacy. And then we'll open up for questions. Does that sound good? Okay. Okay, I see everyone. I'm gonna, that folks are nodding. Okay, so a story. So I gave birth to my third baby. I have three beautiful baby girls, and I gave birth to my third baby last year. Not last year, actually 2 years ago, she was born at 2014, 16, 18. She was born 2018. So a few years ago. And about 2 days or so after delivery, my feet, my legs were so swollen. They were very swollen. I was checking my blood pressure at home and it kept rising, 140, 150, 160, 170. And I called my obstetrician and she said, you know what, I'm afraid you may have a condition known as preeclampsia. And for those who don't know, it essentially is a condition that pregnant women can get at any time of pregnancy, prior to delivery, during the delivery, labor and delivery, or immediately after delivery, where your blood pressure goes up and then your organs start to fail as a result. And so kidneys and liver and everything else. And then it eventually can impact the brain with the seizure, or one can have a stroke and one can die. It's a common complication of pregnancy and also affects a lot of Black women are disproportionately affected by it, but not because of anything biological, but again, because of exposure to chronic toxic stress as a result of living in a racist and sexist system. And so for me, my OBGYN doctor was very concerned and she said, you need to go to the hospital right now, right away. Well, this is the thing. I was nursing, I exclusively breastfed all my children, and certainly I was breastfeeding this little one. So I was really concerned about taking a little newborn back to the hospital and having to deal with the hospital while nursing. And I hadn't gotten to a stage where I was able to pump and have, supplies for folks to take care of her at home. So essentially it became between the baby and my health. And we decided to not choose and go with both. So my family and I was staying with my parents at the time. We culturally do that, traditionally stay with with the woman who just had a baby, stays with her parents for as long as needed. Until she feels more comfortable with the baby by herself. So that can be weeks and months, and then she can go home. And then the husband of the woman's husband prepares some gifts for the woman's family to thank them for taking care of his wife and new baby. And so we call that omugwo. So I'm from Nigeria and I'm Igbo. So that's the traditional practice that we have. So I was with my parents and we took the baby and everybody packed up and went straight to the hospital, went to the ER, they checked my blood pressure. It was like 170. And I don't know about you guys, but if you don't know, I'll tell you it is high. And so they were very worried immediately. They got me into a room, started the medicine. And throughout the time I was able to nurse. Now, the next step with that is to admit me from the emergency room to a special unit called the maternal special care unit, which is almost like the ICU of new moms, pregnant moms. And so the problem was this: I had a baby, and they said that babies are not allowed in this unit, and the baby will have to go home. But my pushback was that, well, but the baby, I'm nursing the baby, I'm pretty much the baby's food. We don't have any pumped milk at home, so baby has to stay with me. So what's the deal? And they said, well, I'm sorry, the policy is no baby here. I said, first of all, this is called a baby-friendly hospital, right? And I don't know if you all know, but there's this movement nationally for baby-friendly hospital, which means it's the hospital policies, everything about the hospital should be centered around encouraging breastfeeding. So this is not encouraging breastfeeding. So what's going on? And they said, no, you can't have the baby. So I pushed back and I said, well, I don't understand. We're going to have to go ahead and make some accommodations because this baby is depending on me for their life, and I need to be taken care of so that I'm here for me and for the baby. And so I don't see the problem having the baby with me in a cot by my bed bed, and so I can, take care of the baby. Well, I tell you what, it was such a back and forth. I asked to speak to everybody. I wanted to speak to the managers. I wanted to speak to all the doctors. The doctor was like, I support you, but I don't make the rules. So it's don't necessarily make the rules. That's another kind of level here in terms of advocacy and knowingly called. I had good relationship administrators, like the chief medical officer. She was vice president or chief medical officer of the hospital. And by the way, this is my hospital setting. And it was late at night. By this time, we're talking 11 p.m. or midnight, something like that. And so, and hassled her. Long story short, they kept me in that ER all night in a very uncomfortable bed, but I had my own room. They kept me till the morning time, by which finally, having talked to as many people as I could, the morning administrator was able to, who was a Black woman, was able to say, it's okay, let her come up, as long as there's an adult present that will be responsible for the baby. And so that's how we were eventually able to go upstairs with my husband. And initially it was, they said, well, they don't want to be responsible for the baby. The baby is not a patient. So I was supposed to feed the baby and then give to my husband. My husband was going to go off to the, out of the room to the, I don't know, somewhere to stay with the baby and only bring the baby for me to feed, which was ridiculous. So finally, one of the administrators was like, this doesn't make any sense. They can just stay together. And that's how I got a crib. I got everything that I needed. But it took all night going back and forth, talking to everybody and their mother for someone to finally see some sense and accommodate and meet, my needs, and me just not backing down, because I knew that, breast is best. And I wasn't going to jeopardize my child's, health for a policy that made no sense. That does even, which is contradictory to the stance of the hospital about being baby friendly. So that's my story. The second story is a person who you may have heard, who's called Dr. Susan Moore. Dr. Susan Moore is an African-American physician who was admitted to a hospital in Indiana, northern Indiana, sometime late last year. She had COVID-19. She was in a lot of pain and she was asking for care and she wasn't listened to. And she had to pretty much prove to her care providers that she was in pain by getting a CAT scan of her neck and her chest. She had risk factors, other illnesses that placed her at risk. And so she was just, she pretty much was fighting for her life, and she wasn't really being heard. And she took to social media and made a video and sent it out on social media. So that people know what's going on. And you can Google Dr. Susan Moore, and I think Dr. Sapp has her name and can put it in the chat, so that you can watch the video, and where she pretty much broke down. This is pretty much saying, if I was white, I will not, I remember her where she said, I submit that if I was white, I will not be going through what I'm going through. And she was right. The literature shows that she's 100% right, that when Black people, and especially Black women, complain of pain or discomfort, that they're not heard and they don't receive the care, that the standard of care that is offered to their counterparts who are white. And so she received sub quality care, was discharged too early, and in less than 12 hours had to be readmitted, but she begged to be taken to another hospital where she subsequently died. What happened to her, certainly experiencing racism in medicine, is actually the impetus for effort, speaking of advocacy, that I'm part of. We developed created an organization, a group called Coalition to Advance Anti-Racism in Medicine, and we are writing legislation called the Dr. Susan Moore Anti-Racist Act for Public Health, in order to make sure that such a thing never happens to anybody within our health systems again. And we are doing that on a federal level. So I tell these two stories because as examples of, in my case, my self-advocacy was because, I knew the system. Both myself and Dr. Susan Moore, Dr. Moore knew the system. We're physicians, as a matter of fact. And so if we even go through this as physicians who know the system, how much more people who do not know the system, right? And what they're going through. So, in my case, it had a positive ending. In her case, it did not. I offer these two stories just for your consideration and reflection as to, what are some ways that we can advocate. And then also to remind us that sometimes when we do advocate, it may not go the way that we desire, and what are some next steps. So in my case, some of the steps that I took to advocate, one is knowing the system. Because it was my hospital system and I knew some people, I could actually call those people to say something is going on that I'm not happy with, and I'm going to need your help to address. And so that was really helpful. I knew that I could go over, quote unquote, people's head. I knew that just because somebody says something is a policy doesn't mean that it's necessarily applicable to my case, and that there should be a way for that policy to accommodate unique circumstances such as myself. So number one in advocacy is knowledge. Knowledge and understanding of your, the healthcare system, that particular healthcare system is really helpful. If you know somebody, great, but not everybody knows somebody, that's okay. But knowing that there are people whose job is to advocate on behalf of the patient and asking to speak to those people is very important. So almost every, if not every, healthcare setting should have a patient care advocate, someone called a patient care advocate. Maybe there are different names for that person, but they should be someone in that capacity that can speak on your behalf. Beyond patient care advocate, the chief medical officer or the vice president of medical affairs, or just the vice president, is another person that can be called on your behalf. And so if you're not getting the care that you need at that point of care from those immediate providers, those are people that you can ask, and you have the right to, ask for, to say that, you don't feel like you're getting the care that you need, you don't feel like you're getting listened to, or you're being heard, and that you would like to speak to a patient care advocate or the CMO, the chief medical officer, or the vice president. So those are important things. The second, and so that's number one, that's something that I was able to, advocate for. The second thing that is so important is to know your medical conditions, know your story. Nobody can know your story more than you. You need to know, what are my medical conditions? What medications am I taking? Why am I taking them? How much of them do I take? What are my allergies? You want to know what your medical condition is. If you have any questions or any needs specifically that you want addressed, you want to write them down and be able to ask and make sure that is answered to your satisfaction. And if it's not answered to your satisfaction, you want to actually respond and say, hey, this is not answered to my satisfaction. Could you please explain it again or make it clear? So for me, in my condition, I understood what preeclampsia was. So when the doctors were talking to me, I could understand it and I could ask them questions, what is being followed up? How will we know when things are better? And so on and so forth. I could ask those questions because I had understanding of preeclampsia. I don't have to be a doctor to understand preeclampsia, because if I had a condition that I didn't know of, then I would ask, I want to understand this condition more. Can you give me a picture, a comic, a book, an article, something, so I can read and understand this condition for myself and formulate some questions that I will ask you to ask, so that you can help me understand. So that's what I was able to do, as because I had good understanding of the condition, I could ask questions. And even being a doctor doesn't mean, because when it happens to you in your body, you are dealing with so many emotions that even you need to be You need that kindness and that explanation and generosity of spirit, at that time, because it's happening to you in your body, and that emotion there sometimes is difficult even for you to remember your medical knowledge. So you physicians or the healthcare providers, the healthcare professionals also need to still come at you with respect and dignity and kindness, and still break things down, and then sort of use your questions to then guide how sophisticated or simple they should make their explanation. So knowing and understanding what your conditions are, so that and using that to ask questions and make sure you're writing them down and you're writing the answers. It's so for around your medical folders, or whether it's on your phone, it's hard copy, or it's electronic, whatever it is on your computer, but having all your medical information organized, so that at any point in time you can just pull it out and say, bam, there you go. And for some folks, for some settings, a lot of settings are doing this now, where there's a patient portal, so that you can participate in the portal. And you can open up and say, okay, what are my studies? Did I get a chest x-ray? What did it show? I got this lab work. What does it say? And then, oh, I don't understand this. Then you can send a question to your healthcare professional. Hey, I just saw that my potassium is high. What does that mean? Etc. Being engaged in your healthcare is so critical. And you don't have to know anything about it, but know that this is your body and it's your health, and you are the CEO of your health, and therefore your healthcare team works for you. Okay, is so critical. In being able to advocate for oneself. It doesn't matter, and you can teach your healthcare professional to speak to you at the level that you understand. And so if they're speaking to how you say, no, make it simpler, ma'am, make it simpler, sir. I want to really understand this. This is my health. Or if they're speaking too simple and you're someone who has a lot of knowledge, you can say, that's okay. You can make it more sophisticated, or you can ask sophisticated questions that will tip the healthcare professional to know that, oh, you have some more knowledge, and that they can then, be a little bit more sophisticated in the way that they communicate with you. The bottom line is that you teach folks how to treat you oftentimes, and when you're not getting what you need, then the next steps that you need to follow. And the third thing also to be mindful of is, well, what happens when I have I know my business, I know my medical conditions, I have my questions, I write them down, I have my medical information organized, I'm writing and I'm active and I'm asking questions and all of that good stuff, right? And I wasn't getting what I need, and then I'm engaging the patient care advocate, and I'm engaging the CMO, and I'm engaging the vice president, and I'm still not getting what I need. Then what do I do? And so the third part is to be knowledgeable about what are the resources in the community to help protect patient needs. So there are a number of patient care advocacy groups that you can get online, and you can find the ones that are in your community, in your neighborhood, in your zip code, in your area, in your county, and that you can actually reach out to. The health department is another place that you can also reach out to label concerns or complaints about your experience at a certain place, in order to get some recourse, in order to get some recourse, right, from that experience. So knowing those resources are very important as well. Ultimately, as I'm beginning to see in the chat as I conclude my remarks this evening, is creating a culture that's opening to listen with the intention. Ultimately, and I've said this in other talks, is that it really is up to the healthcare system to be such that people don't have to advocate for themselves, because there's no need to advocate for themselves, because we are providing that, wonderful, conducive environment of safety and love and kindness and healing and restoration for everyone. But we're not there yet. And until we get there, unfortunately, there is a need to advocate for ourselves. But yes, as physicians and as healthcare professionals, it is really up to us. It is our responsibility lies in our approach. No policy is one size fits all. We have to accommodate people and meet them where they are. And most importantly, listen and be willing to accommodate and to be flexible to meet the needs of our people. Absolutely. We have to be very conscious about checking our own biases. Where are we being biased here? Everybody, if you're born in this country, in the world, but we'll talk about the US, is biased. We are born into a system of inequality and inequity, and encoded and codified in every aspect of society, every system. So there's no way that we don't inherit biases. So we do have those biases, right? But what it then calls on is for us to become aware of those biases and interrupt them on a daily basis. When a woman says she has chest pain, to not say, oh, it's anxiety, just give her some pain medication and walk off. When a Black woman especially talks about the same, that we just pause and listen, and reduce the triggers around us that actually predispose us to engaging in our biases. So when we're hungry, we're angry, we're emotional, we're tired, we're stressed, we're rushing, all those things lend itself to us relying on our mental shortcuts, which are the biases, as opposed to taking time and slowing down, taking a deep breath and engaging in that person as a human being, lifting up their dignity and their humanity. So this is where I will conclude. I thank you again for inviting me for for this wonderful program. I hope that I have shared some helpful thoughts around what advocacy means, why it's important, how does one advocate for oneself, and the other two important notes I want to also end on is I mentioned to you with Dr. Moore's story that it really drove a lot of activity. A lot of people are doing different things as a result of her story. But like for myself and some of my my colleagues who are primarily Black women, is to advocate on a larger level. And that's the other piece. But sometimes we self-advocate by advocating with others. And it's like we advocate for the collective. And since we are part of the collective, we benefit from this advocacy. And so the collective advocacy that I've gotten involved in, which will benefit me and as it benefits everyone, is to advocate for legislation that will be protective of Black folks, folks of color, when we are in these healthcare settings, that will protect us from the negative outcomes, right, in healthcare settings that do not listen, and build in accountability for those healthcare systems as well. So that is another level of advocacy that we self-advocate through advocacy on that level, legislation, and also community coalition building. And then the second piece of advocacy too is where you advocate for your these pieces that we talked about also apply when you're advocating for your family members, because sometimes it's not even about you. It's your mom, it's your dad, it's your brother, it's your sister, it's your cousin, it's your friend, it's your neighbor, it's someone that is someone you're providing care to or care for, that you can, these same approaches can also be applied towards them. So with that, I will conclude. I thank you again, and open up for any questions, thoughts, ideas, comments. I'm eager and excited to hear your feedback as a result of listening to my remarks. With that, I pass it on to Dr. Sapp, and thank you again.
Dr. Apara, thank you so much. I'm actually going to pass this over to Priscilla because she's our moderator for today. So I'm going to let her do her thing, and she's going to do the Q&A and do the closing and invite Faith to do the closing. So thank you. That was such a wonderful talk. I'm actually getting text messages from people who have my cell phone talking about how great the talk is. So thank you so much for that. Priscilla?
Yes, Dr. Apara, that I know, especially for myself as a Black woman, hearing all those points that you've brought out, certainly makes me think of what I'm going to do at my next doctor's appointment. So we encourage anybody who has questions for Dr. Opara to either unmute yourself and ask, or you can post them in the chat and I can ask Dr. Opara for you. But that was very, very knowledgeable, and I really appreciate you bringing out the points about kind of being knowledgeable. I know that I'm not a doctor, or I just work at a medical school, but when you don't know what's going on with your body, it is scary, and you want to know what's going on with yourself. So it is so important for us to know what's happening and to ask those questions. So I really do appreciate that. But I'm going to let others have the opportunity to ask you questions. So we'll give that to open the floor now for that.
Thank you so much. Thank you. That was a very, I appreciate those remarks. Thank you.
I have a lot of thank yous in the chat, Dr. Opara. Everyone really appreciates your knowledge on this. I guess I do have a question if we don't have any now. I have a Black mother, like a lot of us in this chat. So, and she is very tentative to trust medical professionals because of past history where it's like, she says she has pain or she has this or she has that, and she's questioned about her mental state if she's needs to see a psychiatrist. How would you suggest to have someone who's had those kind of experiences kind of be able to be back in the space where they have control and they feel like they are being heard?
Yeah, that's a very good question. And I would say that, you know, this talk is by no means comprehensive, right? There's so many pieces to unpack and unravel. So, for example, what you just said, like, you know, I didn't even talk about the history, right? Like historically, there's, you know, Black folks have good enough reason to not, you know, trust the medical establishment based on, you know, very troubling, you know, racist and dehumanizing activities in experimentation and treatment throughout history for the past 400 years. So, the medical establishment, in general, suffers from a trustworthiness problem when it comes to the public at large, and certainly amongst Black folks. So, a lot of our moms and grandmoms and great grandmoms were alive at a time where they couldn't vote, or they they didn't have, you know, access to quality care, whether the presence of, or even if there was a healthcare setting, to get like respectful, appropriate, culturally sensitive care. So their tentativeness and hesitation is 100% valid. I think that's the first thing, is that to affirm someone like your mom that, you know, Ma, I get it. Like I get it. You are, you know, you're right. You're right. It is, you know, these experiences have been terrible, and so and a lot of it is because of you being Black and a woman, and so it's so important to affirm people that have that hesitation that's built in that history, whether the collective history or their own personal history. So that's the first thing. And then the second thing is to then talk about this. What are you looking for in a doctor? What do you want in a healthcare professional? Because it may not even be a doctor, it could be a nurse, a nurse practitioner, could be anyone in the healthcare field. What is it that you are looking for? What are those characteristics? Okay, no problem. Once that's clear, then is a question of, well, let's see, how do we find that person? And so one of the ways that people usually do go, one of the most common ways, and it's been this case for you know, ever, and it still is today, and that is word of mouth, you know. And I know, and let me share this, there is an app called, I'm looking in my phone right now, it's called MD Cares. Hold on, give me a second, I'm gonna find it in a bit, but there's an app that a few Black doctors actually created, and it's like basically a directory of Black physicians. So I will, during the course of this, I'm gonna look in my phone and see if I think is Black MD Care.
I'm having trouble hearing you, Dr. Apara. I apologize. I don't know if it's my service or.
You can download and put in your, I think, your zip code, and it will show up, the doctors, Black doctors in your areas as much as who have been registering in it. But oh no, you don't have to have, no, can you, Dr. Saab, can you hear me? Hello?
I think we can hear you now. You had
Hello?
broken up for a little bit. Can
Hello?
you hear me?
We can hear you.
Hello?
Can you hear us?
If anyone can hear me, can you unmute? Okay, I can, oh, yes, I can hear you. Can you hear me?
Can you hear, can you
Hello?
hear
Can
us?
you hear me?
Okay. Yes.
I can hear. Okay, can you
Okay.
hear me now?
Mhm.
Can you
Yes.
hear me? Okay, you can hear. Okay, good. Thank you. Sorry about that. It's probably not you. I'm in the hospital, so our reception isn't the best. But yeah, please, if you can hear me, just certainly just yell out or put in the chat that you can hear me. So I think what I was saying, that there's an app called Black MD Cares, but usually, okay, Dr. Sapp, I said I can turn on video. Okay. Okay, is that better? You can hear me better now?
Yes, yeah, much better. Thank you.
Okay, yeah, no, yeah, thank you. So, yeah, I think, okay, Dr. Sapp said that's great. Okay, awesome. I'm glad. So there's an app called Black MD Cares. I'm gonna find it and put it in the chat. So that's an app where that Black doctors created in order for folks to be able to find Black doctors in their area. But word of mouth is usually very helpful. And so just talking to folks like, hey, who's your doctor? Do you like your doctor? Is there a Black doctor that you are seeing, or Latinx doctor that you are, excuse me, excuse me, I had to sneeze, that you're seeing, or Asian doctor, or whomever that you think is of, that is going to be culturally congruent with you, culturally sensitive to you and your family. So word of mouth is an important source for finding then who will match these characteristics that you think is going to work, for you. And then I see Jennifer says another resource to begin advocating for change is, okay, and put a resource there from Plaintree, 6 steps to creating a culture of person and family engagement in healthcare. Okay, this is really good. Thank you for sharing, Jennifer. I'll definitely save this to my toolkit there. I appreciate you sharing that. But yes, dear, I think word of mouth is really helpful to connect us to the people that you think, other people have tried and have found to be true to providing that culturally humble care and find care that we all deserve. So that's what I would say. But I would say the first thing is to affirm someone like your mom in what they're feeling. That's the first thing. And then secondly, to ask her to actually write down what she's looking for, in her professionals, healthcare professionals. And then, commit to looking for people that
We can't hear you, doctor. I can't hear you.
Oh, it did it again. Hello?
Yeah, cut out for just a few seconds though.
Okay, no problem. No, this will give her a sense that she and choose people that she thinks match those qualities. I think just giving her the power of choice, but still limiting the options. But what the doctor, who that doctor approach that. Does that make sense? I know.
Yes, Dr. Apara, your network is cutting out a little bit, but yes, absolutely. I think that it would be helpful for her to feel like, she's being heard from jump than going in blind. Those are definitely helpful tips that I can utilize, and I will definitely look at MD Care, because I think even for myself, I've kind of always kind of went with it and been dissatisfied in some of my healthcare experiences. So I
Mhm.
think that knowing what I want out of a care provider will help me to find someone who can be culturally, and I think I'll feel heard and feel satisfied when I'm done with whatever doctor appointments I have. I think that a lot of times I know from experience and hearing my mother is like every time you go to the doctor, it's like a dissatisfying kind of experience. And I think we have to step away from that and kind of understand we can find places where we're heard and listened to and can get good care. So I appreciate that very much.
And Priscilla, I like that, what you're saying, and Dr. Apara, what you're saying as well. And, if I can be a little vulnerable myself, I remember when I was going to the doctor and I had fibroids, right? The story of Black women's life is to have fibroids, right? And the doctor was telling me that I needed to have, them removed. I had 7. And she was telling me I needed to have it removed. And she was talking to me about a hysterectomy. And, this is when I'm in my 30s. And I'm like, absolutely not. I want to have children. You're not. And so she was like, well, your uterus is going to be Swiss cheese. And I looked at her and I said, God can do something with Swiss cheese. He's not going to be able to do nothing for me if I don't have a uterus. And so she was like, oh, so you practice religion? Absolutely. And it's like it shifted her whole mindset once I said that. And it just changed for her once I said that I believe in God. And I'm like, God can do anything with Swiss cheese. He can't do anything if I don't have a uterus. So no, you will not. And I was actually considering going to someone else to have the surgery, because you have to sign that paper that says if anything goes wrong in the operating room, that you give them the right to go ahead and make the decision to give you a hysterectomy. And I told her, I said, if I wake up without a uterus, there's going to be some furniture moving around in this hospital. I just want to be clear. And she was like, I hear you. I will do everything I can. I wasn't aware that you were faith-based, and I don't know what that had to do with it, but I had to have that come to Jesus moment with this physician. And, when I woke up, she was there. This is the first time I've ever had major surgery. I've never had to go to the hospital for anything. I do not like being in the hospital. They don't have locks on the door. These people are coming in. I don't like it at all. And so when she was by my bedside in the recovery room, and she was like, we saved the uterus. And I said, oh, I appreciate you. She said, we had to do some blood transfusions, but you had 32 fibroids that needed to be removed. So I'm walking in there with just 7 needing to be removed. And once she got in there, it was 32. And she had a picture of it and asked me if I wanted them. I'm like, I don't want, what am I going to do with those? But really understanding to have a relationship with your physician and them understanding what your needs and your wants are is so important. So thank you so much for sharing that and understanding that if we are a little vulnerable with our healthcare providers, they can really provide the best type of treatment that we want. And at that moment, I was like, woman, if I wake up without a uterus, it's going to be a problem. So
Yeah, no, I appreciate that so much, actually. And I would tell you this, patients, you teach us so much. We after we're done with school, even while we're in school, certainly, I tell you, my most memorable teachers have been my patients from during my training to now. Literally today, I just took, I saw a gentleman. I walk into the room and he's all like looking all despondent. I'm like, what's going on? First time I haven't seen him yet because I just took over the team today, and he's just talking about his partner who's giving him stress and problems, and you know, she's not listening, she's doing all kinds of things. And so, and I just, you know, start talking. We just start chatting and, you know, connecting. And then when he's done, he's like, I'm sorry, doc, I didn't mean to take your time. I said, are you kidding? No, this is good. You know, I've learned something about your life that will help me to ensure that the care plan we come up with is conducive, right, to your life, so that you it helps make your life easier than more difficult. You know, from our conversation, I found out the problems, and he doesn't have a rail, you know, in his house to go up the stairs to get into his house, and he's gonna need some things to be able to basically live his life as functionally possible. And if we did not have that time to just kind of chat for a bit and find out the stress that he was going through, you know, I wouldn't have found that out, and I would have discharged him from the hospital, and guess what? 2 weeks later, he'll be back. So I think, you know, to your point, it's so important that we give the physician, you know, sometimes I tell people, you got to teach people how to treat you, physicians. I know people, you know, who have just stopped, you know, my trainees, wait, don't say that, don't talk to me like that, is not important. You know, that train their doctors how to take care of them, and burden should be on you. But I would just say that because unfortunately we are in a system that is not, you know, when we look at the healthcare system as a whole, it is not humans with advocacy on that level of, you know, having a health and all policy that is kind and that centers humanity and humanism, and that's another level of advocacy. But in the meantime, in between time, you know, talking to you, this is what's not important to you, although what you value and what are your priorities. And if you don't feel heard, to say, I'm not feeling like you're hearing me. Sometimes that just stops people in their track. What can I do better? You know, so I agree wholeheartedly with giving your healthcare professional a chance, and only then, yeah, and don't then. I definitely agree with what you're saying. You gotta communicate and let your people know what you need. Absolutely, that's the first step, like we talked about. It's self-advocacy. It's saying what is it that you need, and then navigating to get that. Any other questions, thoughts, or comments? When are we supposed to be done, Dr. Zapp? When is this over? 1 o'clock or 1:30?
This is over at 1:15, so we have another 5 minutes of questions. Priscilla, you're on mute. We have another 5 minutes of questions.
Hello.
We'll wrap you up, and then we'll close with Faith, and she'll finish closing out the program also.
Okay, sure, no worries. Okay, any other questions, thoughts, comments?
I'm not
do
sure
have
if you
some-
can hear me. Can you hear
Yes.
me?
Yes, go ahead.
Hi, my name's Ms. Robert. I just wanted to commend Dr. Zapp for taking full control over her body and being engaged in directing what you want to be done to your body. Last year, 2020, I went to my regular appointment, and the nurse came in and she told me, well, did you have a pap smear last year? And I said, yes, I did. And she said, oh, you may not get a pap smear this year. And I said, well, she said, because they're not doing it every year anymore. And I said, well, I don't care what they say or whoever, but I'm requesting for a pap smear because for myself personally, I've had pap smears that have come back with things and questions where I have to go get further testing. And, you know, that's something I know, of course, but she didn't know. So when the doctor came in, I also told her, I said, I want a pap smear. She said, oh, sure, okay, we'll give you a pap smear. And it worked out okay because I had a different insurance. My company had, not my company, but my employer had changed their insurances. But I believe as Black women, we really have to tell them what we want. And I was telling her, even the doctor, I said, even if it wasn't approved or something, I'll pay for it. But I need to get my pap smear done. I need to have a peace of mind to make sure that I'm okay. So I think it's very important that you advocate for yourself. Also do the research, because I did go back and look at the insurance, my insurance plan. I called the customer service to ask more additional questions, because what we do is we accept, and I'm not saying that all medical professionals do it. That nurse, you know, she probably was just routinely saying something that, you know, she's supposed to say, but you have to be engaged, you have to be informed, you know, like, you know, the doctor has said, we have to be informed and engaged. First of all, you're paying for it, and you only have one life to live. One mistake can cost you your life. Just like Dr. Sapp, if she did not say that, I mean, she would have just taken it out. I mean, like, who does that? So I just want to encourage everyone. Thank you so much for being part of this session. You're totally amazing. And just everybody, you have to advocate for yourself and for your families as well.
Thank you, Ms. Roberts. That was great. We appreciate that. And you are so right. We really do have to, because I was told the same thing this past year too. So we do have to really know the system. I think you're doing a great job calling your insurance, because that's a big part of it too. So thank you for that.
And let me add, can you hear me okay?
Yes.
Good. And so let me add, so exactly, that's another part that is important when we talk about knowing the system, not just your healthcare setting, but the healthcare system as a whole. A huge aspect of that is the payers, your insurance. Yes, and knowing what your insurance covers, what it doesn't cover is so important. And knowing the benefits as well as what doesn't, you know, the benefits, the limitations, but also the benefits of insurance. I know that I have patients who didn't know that their insurance covered gym memberships. And so we'll be talking about exercise, and they'll be sort of going back and forth, and maybe cost of gym membership is an issue. Come to find out that there's certain gyms that their insurance would have discounts with. So I think that is another part of knowing yourself, knowing your history, knowing your medical conditions, but also your insurance situation. And then there's another important thing to bring up, because you brought up the pap smear. I think what is very important, a very important question to ask foundations is why. It's your satisfaction, you know, where you understand, oh, I see. Because, you know, oftentimes there are things that we think that we need, but we find that we really don't need it. So for example, if you don't have any other issues with your pap smears, no abnormal pap smear history or cancers, or, you know, other issues, let me put it that way, 3 years, and then after a certain age, every 5 years, if you get also HPV guidelines, for example, have changed. Same with mammograms. So
I think we're having some issues again hearing you, Dr. O'Hara.
But what is important is that I just tell you and then walk off. Like, that's not acceptable. It needs to be explained. Now, if after you don't want, you still want to, proceed in the way that you see fit, that's another conversation. That's okay. That's a
Dr. Opara,
conversation
I don't,
that can be had. So, okay, is it better now? Hello?
it is a little bit better. Yeah, it was
Hello?
lagging a lot. Hello, Dr. Opara.
Hello?
I think we can hear you, but you can't hear us. We only have 2 minutes left in the session. So
Yeah, can you hear me?
we,
Hello?
it's very choppy.
Yeah,
I think
can you hear? I can hear you. Can you hear me? Okay.
I don't know if I'm the only one having trouble hearing Dr. Opara, but we only have 2 minutes left.
Just read. I'm chat. Read my comments in the chat.
Okay, thank you, Dr. Opara. We appreciate that. We appreciate you coming out to talk to us. I'm going to, I believe we have the next events posted in the chat, but I'm going to share screen quickly for everyone to see our events coming up. And Faith, you mind going over that with everyone?
Sure. Thank you so much, Priscilla. Thank you, Dr. Opara, for that talk. You really encouraged a lot of us to share our stories and to, take more control of our health. Thank you, Ms. Robert and Dr. Sapp and Priscilla, you for sharing. It's good to hear that, you're not in the struggle alone. So if you could just advance the next slide, Priscilla. We have a couple more events coming up before the month ends. Tomorrow, we're going to be having Sharon Sanford, Turning Pain to Purpose. So that'll be tomorrow from noon to 1:15. On the next slide that Priscilla will pull up, there is a QR code that you can scan to register for the event. Please try to register before noon the day before for every event. And Dr. Sapp will be emailing with the mug winners. So just look out for that email. Thank you everybody for joining us today. It was great. And we hope to see you at the next event tomorrow. Take care.
Thank you everyone for coming. Have a nice day.
Thank you. Thank you.
Let's see here. Thank you, Dr. Sapp.
Great, thank you.
Yes.
That was
Yeah.
awesome. Do you
No problem.
feel, I didn't even have to leave because the doctor didn't call. And I'm like,
Oh,
what?
no.
Why didn't he call? This is ridiculous. My sisters are like, where is he? What's going on? I'm like,
Yeah.
I don't know. So I'm gonna, I usually copy the chat, so don't take up.
Okay.
Copy this chat and give the chat box stuff to the presenter so that they'll have it. If they want to follow up with anyone, they can do that. How are you doing? How's everything with you?
I'm good. I'm good. Had a good weekend. Was able to, I've been so busy that this weekend I needed to rest and went and got my nails done and went out to eat once. And I was like, okay, I feel like I can handle this week now.
Like person again. That's how I feel. I'm just
Yes.
I didn't even get up and do anything. Usually I take a
Yeah.
shower at lunchtime, but we having these lunchtime events.
I know. I'm just like, I've just been good with the new job and school and just other stuff going on in my life. I'm like, this weekend I actually
That's good.
took some time and I was like, all right, I
Feel
feel
a
like,
person. You did stuff for you.
yeah.
Wonderful.
And it's like, I put it on the back burner so much because it's just like, I don't have time. So, but this weekend I was like, nope, I'm reaching a wall. Go do something, but I feel good. And this talk was great. So very relevant to my life because I need to find some new doctors.
Absolutely. You got the link.
I'm
So
just like, the last time I went to the gynecologist, a whole new nurse practitioner came in that I didn't even never met before. And I'm just like, what is happening?
I'm like,
You're
I
not
wanna
my
figure out
doctor.
what's
Where is my doctor?
my cat. Like, what are we talking about?
Right.
We need
Right.
some consistency here. You don't just let
Yeah.
anybody up in there. What are we talking about?
Oh, and I'm just like, personally, I've had some very bad, especially with gynecologists. I've had some horrible experiences. So I'm just like very picky about what is going on down there. And I just,
As we
this is
should.
great.
Right?
Yeah.
There's
Yeah,
some
absolutely.
dignity. There's some, you need to respect the body, and then you know the history of the father of gynecology.
Yeah.
what he did
And
to
it's
black
like,
women
you know,
and-
this is someone that if I was to get pregnant yet tomorrow would probably give birth to my child. So it's like, not just, you know what I mean? Like it has to be, I can't just have any willy-nilly person you throw on my chart in my, I'm like,
and people
I'm like ready to go to Philly because I want a Black woman to be my gynecologist. I'm done dealing with this.
exactly. And people don't
I've-
understand that, right?
Yeah, I'm like, I've tried to have like a Indian woman. I was like, oh, that's a woman of color, like cool. But then they threw her off my chart, put some other woman. I'm just like, no.
And I had, that's who I had. And when I was at the University of Rochester, I had an Indian woman, and I was just
Mhm.
like, well, if we take 7 fibroids out, your uterus is gonna be like Swiss cheese.
Just
don't
even
give a
that
damn.
description is just very offensive. I don't like
I
that.
don't give a damn. God can do something with Swiss cheese. He can't do nothing if I don't have a uterus. What are you
Right.
talking about? And who the hell are you to decide that I don't, my healing can happen.
Right.
Healing
Right.
Can happen. You don't
I think this,
decide because you have to take 7 fibroids out and then ended up taking 32.
right. Because my mom's had the same issues. You know, like you said, it's the story of a Black woman having fibroids and all kinds of
Yeah.
cysts and all that polyps. So I know that's in my future. So I'm like, I need to find someone who
Well,
hears me, understands me,
need
I
to
feel
find-
comfortable.
You need to find how to eat, how to make sure you're
Right.
relaxing. That's what you need to do. If you are concerned about that now, then you need to start eating different.
Oh yeah. Yeah, my mom gives me articles on what I should
Absolutely.
eat, what I shouldn't eat, which is
Yeah.
great because she know like very much like what's happened to her body has like kind of happened to my body. So I kind of know what to look forward to and what not to look forward to.
That's
And
right.
she had to get a hysterectomy kind of young. So
What I'm
and
saying, that why
she
is
had
that
been
the
very
answer?
young too.
Why
Yeah,
is that the answer? No, that's
And I
not the
said
answer.
that.
Figure it out.
right. The
Figure it
thing
out.
is,
And that's what I tell people.
Mhm.
Figure it out.
yep, because unnecessary surgeries, like always constantly trying to take things out that don't
Yes.
need to
Well,
come
just
out.
let's rip this out. So now
Right.
you want to sterilize me, even though I didn't have kids at the time.
Right.
But now you want to sterilize me. I can never have children. That is not the answer. And I'm going to reject that right now. Like,
And
what
you
are
know, women are having kids older, so of course, like you
Absolutely.
have to work with me. I'm not having anytime soon, so we're gonna keep things intact if we can.
This is what I'm talking about. But people don't advocate for themselves, right? They don't
Yeah, and
even
I'm guilty of that. I'm guilty of that. I definitely have not advocated for myself as much as I should have. As I'm getting older and learning, I'm like, no.
And even when I went to my last visit in October, they're like, oh yeah, you don't need GY, you don't need a pap smear. No, you're going to do it. Well, you know, it's recommended. Do you know that medicine is heavily ran by men? You think I give a hell what they say?
right.
You're going to do this.
For facts, because me and my friend, she's also a Black woman. She has 3 children, and she's always saying that she's like, nope, because men constantly telling me what to do with my body. I said, exactly, because like even my boyfriend's a PA, and he's like, oh, you don't have to do. I'm like,
Shut up. You don't even know what
I'm like, you have no say over what goes on over here or what kind of tests I need. Cause I did the same thing. And they're like, oh, you need to get a biopsy, you need to do this. And I'm like, okay, give me what I need to know about this. What happens afterwards? That's this, is that. And he's kind of like, he grew up in this, we both grew up in this area. So he kind of like likes to tread softly. And I used to be like that, but I'm like, no. This, I need to understand what's going on, because it's your womanhood. Like, that's my womanhood. Like, that's what I can, my few, like, childbearing, all that. You guys have like 2-3 things you have to worry about over there. Like, I know you got no say over what I need to know about my reproductive system. Please.
Absolutely. Like, what are we talking about?
Right.
This was great. I see
Yes,
you're
yeah.
getting more comfortable. I'm loving it
Yeah.
to see your growth. You're just like, I'm gonna do this. I'm gonna say a little bit about the people. I'm like, you better go ahead.
I said,
Love
I
it.
was like, I don't like how I ran through it so quickly last time. So I was like, I'll just highlight one little snippet about this person, that person. and take
Yes,
out
that
for you.
was
So,
wonderful. That was
good.
wonderful.
I'm
I
glad
think
to
that you're
hear.
feeling more comfortable and growing into it.
Yeah. And I do, it's just practice. You need it. And I'm like, the first couple times I'm like, why did I sign up for this? But absolutely.
After a while, you just get comfortable and it just, especially if you get the stuff in advance, right? The first time I was like,
yeah.
couldn't figure out how I wanted to do it. But now that I have the template, I'm just throwing it right in the template, right?
Yep.
And it's just
Yep.
making it so much easier. It takes time to do it. It takes me 15 minutes. You know,
Yeah.
the first time I didn't know how I wanted to set it up. So you all didn't get it until that day. But
Yeah.
now you're getting it the day before, a week before, a couple of
Yeah,
days.
it's definitely helpful. Definitely.
Yeah.
Anything on the men? Are they behaving yet?
Yeah, they are.
Good.
I have a whole men's sheet. I was thinking that maybe we can do the amend series. Let me show that to you real quick. Do you have time for me to show that?
Oh yeah. I don't have anything else today. Meeting wise, I don't.
And then I didn't eat breakfast. I'm like, see, I just been meeting since 8 o'clock. It's like it never. That's why I was like, I don't got time for people not to be responding.
That's why the School of Medicine, like, I was like, whoa, you guys are in meetings all day long. Like, I was not expecting that, because in my last job I had maybe 1 or 2 meetings a week, our meetings, that was really it. But this one, like, I think Friday I was in a meeting from 7 till 5.
Yeah, it's just ridiculous. It really is. This is what it looks like before we give it to Heather and she can do her magic.
Yeah.
So I worked on it this weekend. So once Heather is able to do her magic, so we have the Black Male Survival Kit when dealing with law enforcement in the 21st century. Live to see another day.
Yes. That sounds amazing.
Then we have the Journal Club, Geisinger's Journal Club. I was thinking that we can do it Tuesday night community chats from 5 to 6. And so this is the Amend the Fight for America episode number 1.
Yeah.
So we just got to come up with the questions before June 1st.
Yeah.
That'll be the first episode. So we're going to have this on June 1st during the day. And then in the evening, we'll have the 5 to 6. So
now who's speaking on the first during the day?
Daryl Gaston.
Oh, okay. Cool.
Gatson. Daryl Gaston. So he's a sergeant. He's a sergeant. And
that's good. Oh, that's awesome that he's a sergeant, because I feel like I told Brian, like, you're going to every single one of these. I don't care if you're busy. Because
so I figured if we keep him on Tuesday evening, we're gonna have to go into July. So we have that.
Okay.
It's about citizenship, right? Who's a citizen, who's who's not a citizen. And then we can have the Q&A after. We can have a hour Q&A. So I was like, I didn't want to make it more than an hour because we're asking
Yeah.
them to watch the episode beforehand, similar to the Black Men in White Coat, and then they come and we just talk for an hour.
Okay. Is this gonna be like kind of, is it gonna be in partnership with the Black Scram Project, the evening one? Okay, awesome.
Mhm.
Yeah, because I was thinking of inviting some other like some
yeah.
just some people I know to try to get them to
Even
like,
the stuff that we have during the day, anyone can come. Miss
Yeah,
Roberts from Atlanta, Georgia.
Yeah, I was like, I saw that it was a number. I didn't know who it was.
Yeah.
That was awesome.
And so this one is after escaping slavery, Frederick Douglass become a pivotal voice calling for citizenship for Black Americans, a dream realized in the 14th Amendment. And then we have Mr. Wagstaff. He's going to talk about long life and prosper through financial freedom. So he's going to do that financial stuff for the men and what they need to do with their money on the 3rd. Then on the 8th, we're going to have part 2 of the series, which is focused on resistance. And so I put a little synopsis next to each of them so that people can have that. And then for Dr. McBride is going to speak on the 9th about HIV and other STDs, statistics, treatment, and prevention, a focus on Black men's health. And then we're going to have Dr. Atkins Sharif. He's going to talk about anti-Blackness as a social determinant of health in schools. That's on the 15th. Then we'll have episode 3 on the 15th as well. And that is focused on weight. Pretty much is talking about Dr. King, and we've waited long enough, right? And they still want us to wait.
Oof, word.
And then we're going to talk about control, and that's about the women's right to vote. And then we're going to go to Dr. Wilkins. He's going to talk about cancer in Black men, the disparities in the science on the 29th. And then we're going to have episode 5 on the 29th as well, and conclude with episode 6 on July 6th, because there's 6 episodes. There's only 5 Tuesdays in June. So we're going to bleed over to July 6th. And then we have these 2 who still have not, and episode 6 is about immigration. And then we have these 2 doctors who still have not given me their stuff. So once they give me their stuff, they email to say, oh, I'm going to give you. So they trying to hold their spot, but they don't know. I will cut them in a minute. So we may have 2 more male doctors that will be able to speak. But I'm like, don't be emailing me, telling me you're going to give me your stuff. So they emailed me before the deadline to tell me they're going to give me their stuff.
Oh, I see.
Yeah, so they want to make the deadline, but not give me the stuff. And I was like, it's just the title. I'm not asking you for anything else. The title, the 2 dates, and the
child, man. Sometimes I don't know who's worse, men or but I'm like,
but I'm like, I'm ready to kill the whole lot of them, honestly. I'm like, y'all getting on my nerves. So, and you know what? In Dr. Rivers' defense, I called him. I never sent him an email because I just got his email address, but I left him a message. And of course, it's his secretary. I'm like, see, I don't have time for that.
Right. Well, looks good so far. I mean, like I said, if we have to cut it down, I'm fine with that. It is what it is. If they can't, get their stuff to where it's, you can hand it in and get it looking pretty for marketing. I'm sure it's not that big a deal. Not that it's not a big deal, but it is what it is.
It is what it is. Absolutely. Absolutely.
All right. I need to eat something. Today is the 22nd. Yeah, it's already almost the end of March. Like, I looked at the date today and I'm like, oh, that's nice. I just I was going through paper. This is how I knew I needed a break. I was going through paperwork last week, and I usually hand in my taxes like the day I get my W-2, and it was like bunched together with a bunch of papers that I just threw to the side. And I'm like, nope, I need to recenter so I can get all this stuff done. It's too much.
It sure is.
Mhm, mhm.
Okay, well, if you need anything, give me a call.
Absolutely. Thank you so much, Dr. Sapp. I hope that doctor reschedules with you guys.
Be better because we need to know some stuff. Like, what are we talking about? So thank you so much, and good luck with your mom and helping your mom.
Thank you. Yeah. Yeah, I think I'm just nervous because she wants to get the vaccine. She's I want it this way. And I get it. She's very more like trepidatious about doing things just because of past experiences. And it's just
Absolutely.
I get it. So I'm definitely going to take the stuff from here and apply it, hopefully, and be as helpful as I can.
Okay, well, take care.
Yeah, you too. Bye.